Well, welcome everyone. Excuse our technical difficulties, but we are now up and going. My name is Daryl O'Sullivan. I'm the Vice President and Treasurer of Western Neuropathy Association, and I'm very pleased to be able to introduce our monthly webinar and our speaker for the webinar. Webinar is going to cover understanding Medicare coverage for infusions, surgeries, and mobility aids, and probably more than that. Anyway, it's my pleasure to introduce Julie Phelps. She has been an authorized Social Security disability representative for over 15 years. In addition to helping individuals secure SSDI and SSI, she is also a licensed health insurance agent specializing in helping disability recipients understand their Medicare options. So, Julie, I'm going to turn it all over to you. Oh, before we do that, one last thing. Please hold your questions to the end, and I will help with reading the questions, and then Julie can then respond as much as possible. And also, we will be recording this and putting this on our YouTube channel. Okay, all yours.
All right, thank you, Daryl. I am going to attempt to share my screen. Hopefully I don't continue the tech issues. I'm going to open my PowerPoint.
There we go.
Okay, everybody can see my slide, right?
Yep.
Yes. Okay, so I just wanted to start by thanking you for having me talk today. Medicare is super complex, and it's really hard to get good, unbiased education about it because you never know if the person that you're speaking to is selling a particular type of plan or if they're covering all of the options available. So I really just want to give you a good overview of Medicare, of the three main options, and talk about how each of those three options cover those specific examples that are probably really important to your community, the surgeries, infusions, and durable medical equipment or mobility aids. So as Daryl said, I am an insurance agent, but my background is in Social Security disability representation. And what that means is it's basically like a Social Security disability attorney, only without the law school and the high salary. Social Security does allow non-attorney representatives to help people apply for disability, appeal denials, even go to the administrative law judge hearing and appeal the judge's denial. Those are the administrative levels of the disability process. So I did that for over 15 years before I started doing Medicare a few years back. And the reason I started doing Medicare in addition to that is because I got frustrated once my clients got approved. And, a lot of them were under 65. They didn't understand the basics of Medicare. And I didn't really have anybody that I could trust to help them through that process. So I learned that process to help my clients, and now that's pretty much what I specialize in. So today, as I said, we're just going to go over Medicare, basic overview, and talk about those specific examples. There will be a Q&A at the end. What I can't do is give you specific plan information. So I can't answer questions about your specific Medicare plan, and I can't talk about plans that may be available and specific benefits. Medicare has a lot of compliance, and for me to do that, I would need to have signed consent and also get pre-approval from all of the insurance companies that I represent. But it will be a good general overview for you, hopefully. Okay, so starting, most of you on this call, I believe, are either already on Medicare or you soon will be. So this probably is just a review for you. You probably already know that Medicare is a federal health insurance program. It's been around for a long time. You probably already know that it is for individuals age 65 or above. The only way that someone under age 65 can qualify for Medicare is if they qualify for Social Security disability, or they have end-stage renal disease. So a lot of my clients, because I specialize with Social Security disability, a lot of them are actually under 65. And then Medicare does assist with healthcare expenses, but a big misconception is that it is not complimentary. There is a premium for Medicare, and there are copays, there are deductibles. A lot of people think when they become eligible for Medicare, it's going to be free. They're not going to have those payments, but they are there. I just want to point out that Medicare is different from Medicaid. Medicaid is a state-run program. Typically, there are pretty extensive limits on income and resources to qualify for Medicaid, and there are not those limits for Medicare. And then real quick before I go on, most of you probably already know the ABCs of Medicare, but just as a quick review, in case there's anybody new to Medicare, or maybe their Medicare will be starting soon. Part A is hospital coverage. Part B is medical coverage. So Part B is going to cover doctors' visits, surgeries, labs, imaging, infusions, anything that you get done outside of the hospital. Part B will cover. And then Part D is prescription drug coverage. So that's Part A, Part B, Part D. The other you hear a lot about is Part C. And it really doesn't make sense why they named it Part C, but I'm going to cover that as we go. Okay, so where it gets confusing is understanding the different options that you have when you become eligible for Medicare. And really, there are three main options. I have color coded them through this presentation. So the first option is called Original Medicare. I'm coding that one blue. And Original Medicare is what the government sends you when you become eligible for Medicare, whether you become eligible because you turn 65 or because you qualify for disability or end-stage renal disease. So when you become eligible, they're going to send you a red, white, and blue card. And that red, white, and blue card is going to say Part A, hospital coverage, Part B, medical coverage. Notice it does not say Part D, drug coverage, and that's because drug coverage is not included in this first option, Original Medicare. And as we go, we're going to talk about specific cost for Original Medicare as well as advantages and disadvantages. The second option is Original Medicare plus a Medicare Supplement, also called a Medigap policy. A Medicare Supplement is just a policy that you can purchase to use in addition to your red, white, and blue card. And it's just going to assist you in covering some of the deductibles and coinsurance that Original Medicare doesn't cover. And then option 3 is Medicare Advantage. This is also called Part C. I don't know why it's called Part C because it's not one of the 3 main parts. Basically, a Medicare Advantage plan combines Part A, Part B, and Part D. So they named it Part C. I don't know why. These are probably the commercials that you see on TV a lot. They are comprehensive plans and they offer additional benefits such as dental, vision, and hearing. And I coded Original Medicare blue, Supplement green, and Medicare Advantage or Part C orange. Okay, so in this main differences table, we'll start looking at the first column, which is Original Medicare, the blue dot. With original Medicare, it's important to know that there really are no networks. If you're just using your red, white, and blue card, then you can see any doctor, you can see any hospital nationwide as long as they bill Medicare, which 99% of doctors do bill Medicare. So there's no HMO or PPO network. You don't have to worry about your doctor or your hospital being out of network. Referrals generally are not needed for original Medicare unless that particular specialist requires a referral from your primary care doctor, but Medicare does not require you to have a referral. Prescription drugs are not included. You do have to buy a standalone Part D plan to have prescription drugs, and they require you to do that. You're penalized if you don't get Part D coverage. Extra benefits, again, there are none on original Medicare. There's no dental, vision, or hearing. The only exception would be if there was a medical condition that caused dental issues. You know, if a medical condition caused cavities, then you could argue that you needed dental care because of the medical condition. And in that instance, they would likely pay that. Out-of-pocket costs for original Medicare can be higher than the others. This is because there are deductibles and 20% coinsurance, and there's no cap on that. So we'll talk a little bit more about this on the next slide, but it's important to remember that with original Medicare, you're not protected. There's a lot of gaps there, especially that 20%, because paying 20% of skilled care or 20% of an expensive infusion that you need to get every month, that could equal tens of thousands of dollars pretty easily. And then as far as the monthly premium for original Medicare, if you're just using the red, white, and blue card, then you just have the Part B standard premium, which this year the standard premium is $185. And it could be more than that depending on if you are a high wage earner from 2 years ago. They always base it on 2 years ago. But most people pay $185 for Medicare. Moving on to the second column, this is the supplement, or also called Medigap. The benefits are very similar to this first column because it works with it. So you still don't have a network. You can see any doctor, any provider. Referrals still are not needed. Prescription drugs still are not included. I will say there are a few Medicare supplement plans that include prescription drugs that are grandfathered. Some people still have them, but they are probably about 20 years old at this point. Most of the current ones, in fact, I think all of the current ones do not have drug coverage. Extra benefits, same as original Medicare. The out-of-pocket cost. So the good thing about the supplement is it is designed to fill the gaps that original Medicare leaves. So the deductibles and the 20% coinsurance, the Medicare supplement plan will pay that. So your out-of-pocket costs are lower. And then the monthly premium for supplements can be pretty high, and it raises each year. And then that premium for that policy is on top of your Part B premium. So you'd have to pay the $185 standard Part B premium plus whatever this policy costs. But you don't have the high out-of-pocket copays. Okay, and then the third option, I'm just going to move this Zoom camera so I can read this here. The third option is the Medicare Advantage or the Part C plan. This is completely different than the other two. This is network-based, so these plans are HMO or PPO plans. Referrals are often needed to see specialists, especially if it's an HMO plan. Prescription drugs are often included. There are some Medicare Advantage plans that are only Medicare Advantage without the Part D part, but most of them do include Part D. The extra benefits are typically included on Medicare Advantage plans. So there usually is some kind of vision coverage, dental coverage, hearing coverage. Sometimes there are additional benefits, silver sneakers, free gym membership. Sometimes there's grocery allowances, especially if you qualify for Medicaid in addition to Medicare. You may qualify for a dual special needs plan, which is a Medicare Advantage plan. And those typically offer a lot of grocery assistance, transportation, things like that. The out-of-pocket cost can vary. The copays depend on the plan. One plan may have a $5 copay for a primary care doctor and $30 for a specialist. They vary a little bit by plan. Usually it's going to be somewhere around those amounts. And then for each service, there's a set copay depending on the plan. The monthly premium for Medicare Advantage is pretty low, especially compared to the supplement. It is the Part B premium, and then depending on the plan, it may not have any additional premium. So you may only have to pay the $185 for Part B, and then the Medicare Advantage plan may be a $0 premium. Some plans may maybe have $11 premium or $50 premium. It really just depends on the plan. I will say the majority of plans that I place my clients on do not have a premium, a monthly premium. Okay, so on the next slide, we're going to start talking about the advantages and disadvantages of both. And really I want everybody to understand that there's no right answer. Everybody has different circumstances. And so I really just want to talk about the advantages and disadvantages of each of these three options. Okay, so we will start with the advantages and disadvantages of the original Medicare option. Again, this was the first one we talked about, the blue. So again, I've already mentioned one of the main advantages is that you can see any doctor or provider. This is especially important. I know there are specialty hospitals in the country, like MD Anderson, the Cleveland Clinic for a while, but City of Hope, I think, in California. But there are specialty hospitals that will only accept original Medicare. They will not accept Medicare Advantage plans. So that's something to keep in mind, but that is one of the main advantages of original Medicare. The cost sharing, which means the copays, they are consistent in that you know what they are. It doesn't vary by plan. You have a deductible each year for both Part A and Part B, and you have a standard 20% coinsurance. And then you do have direct access to specialists. You don't have to wait for a referral. The disadvantages, again, is that it can be pretty costly. In addition to that 20% coinsurance that I mentioned with no cap, there's also a hospital deductible of $1,676. So if you're hospitalized, then you have to pay $1,676 before Medicare covers your inpatient treatment. And that's not an annual deductible. That is every 60-day benefit period. So if you go back to the hospital 3 months later, then you have to pay that deductible again. And then for Part B, which again is the medical, the annual deductible that you have to pay is $257. Once you pay that annual deductible, then again, for Part B, for medical, it's a straight 20% that you're paying. No out-of-pocket maximum. Another disadvantage is the separate prescription drug coverage. So they do require you to enroll in Part D, but there is an extra cost for that. Most Part D drug plans do have an additional monthly premium. And also some of the copays for drugs can be higher on these standalone Part D plans. And then limited additional benefits. So as we talked about, original Medicare does not have the routine vision, dental, hearing services. They're not going to give you, the government's not going to give you the free gym membership or transportation. Okay, moving on to the green, which is the Medicare Supplement. So again, the Medicare Supplement has all of the benefits that original Medicare does, plus it is lower out-of-pocket cost. It's filling the gaps that original Medicare leaves. So one of the main advantages is that your out-of-pocket expenses are reduced. Again, you have consistent coverage. You can go anywhere in the country. You can see any doctor or hospital as long as they bill Medicare, and you understand what your plan includes. They are standardized. The most popular Medicare supplement plans are either Plan G or Plan N. And for both of those, once you pay that annual deductible, your co-pays when you go to the doctor are either nothing or possibly $20 on a Plan N. Your copay when you have a surgery is nothing after you pay that deductible. Skilled care, no copay. So the main advantage of the supplement is that it really does reduce your copays, and you're not worried about that 20% with no cap that could break you. When you are on a supplement, it does have guaranteed renewability, which means they can't end it because of your health. They can't just take you off. So that's good. The disadvantages, these can be pretty pricey, especially if you're under age 65. Some states don't even allow people who are under age 65 to join a Medicare supplement. Again, another disadvantage is that you'd have to get the separate prescription drug Part D plan. Again, it does not have the extra benefit. And another main disadvantage is depending on when you enroll, medical underwriting may be required for a supplement. So they may tell you either, yes, we can cover you, but because of your health, your rates are going to be higher, or I'm sorry, we can't cover you because of your health history. It is important to note that the first 6 months that you turn 65, you have a period where you can get on a supplement without medical underwriting. Also, if you become eligible due to disability, you have a period where you can get on a supplement without underwriting if your state allows it. Okay, we're going to move on to the orange. The advantages and disadvantages of Medicare Advantage. I will not be able to say that several times fast. Okay, so the main advantage to Medicare Advantage or Part C is that the monthly premiums are lower. So, like I said, a lot of them are zero premium plans. They include Part D, and again, a lot of those copays for those medications are lower on a Medicare Advantage plan. The reason why is because the insurance companies have more negotiation power with Big Pharma to reduce the cost of those drugs. Many of the plans come with the extra benefits. If you're looking at a Medicare Advantage plan, you want to look at what extra benefits are available on that plan, and also make sure that your vision provider, your dental provider, is in network with that plan. And then another main benefit is there is an out-of-pocket maximum built in to protect you. So this maximum can vary depending on the plan. I've seen them as low as $400 in Southern California and as high as $12,000 in Florida. So it varies, but the important thing is unlike original Medicare, where, you know, a month in skilled care may end up being $100,000. On a Medicare Advantage plan, you are capped at a certain amount. The disadvantages of a Part C plan. There are network limitations. So again, you have to make sure that your doctor is in network. If you're on a PPO plan, you will be able to see a provider out of network, but again, your copay will be higher in that instance. Referrals and prior authorizations are required. And this is where Medicare Advantage really gets a bad name. It is managed care. There is somebody reviewing claims and trying to save the insurance company money. So when your doctor recommends a really expensive service, then the Medicare Advantage insurance company, whether it's Humana, United, Anthem, whichever company you're with, because it is managed care, they may push back and say, no, we don't think that this is needed. We want them to go to physical therapy first, or they can just decline it altogether. And in that case, either your doctor will have to fill out another authorization with more information, or you have to appeal it. Another disadvantage is the unpredictability of cost share. So the co-pays and co-insurance vary by plan. Now, once you're on your plan, you have a summary of benefits for that plan, and then you know exactly what you're going to be paying for each service. But when you're just looking at which Medicare Advantage plan to choose, those co-pays are going to vary plan by plan. And then another disadvantage is these plans are typically limited to a certain geographic area. It may be 2 or 3 counties. I've seen plans for just one county. I've seen plans for just one big community, so they are limited. There are a few plans that have nationwide coverage through their network, but most of them are pretty limited in service areas. Let me make sure I didn't have anything else I wanted to add on this one. Oh, yes. And when talking about network limitations, I wrote a note to myself to talk about contracts, because a lot of my clients right now that are on Medicare Advantage plans are they've got a bit of a headache right now because their main hospital they were not able to come to an agreement with their insurance company. And so they are not being renewed in that insurance company's contract. And so my clients are having to jump and find a different insurance company, a different Medicare Advantage plan, or different doctors. So on Medicare Advantage plans, I would say another main disadvantage is you have to worry about doctor or hospital contracts and whether those contracts are going to be renewed with the insurance company. Okay, so now that we've gone over the main 3 options that you have when you become eligible for Medicare and what each option covers, how it covers it, what the costs are, now I want to look at these specific service examples. So you can see I still have the color coding. The first column is going to be original Medicare. The second column is going to be Medicare Supplement. And the third column is Medicare Advantage. So the first service that we'll look at are surgeries. Surgeries are very common and they're covered differently by each of these 3 options. For original Medicare, it's going to depend on whether the surgery is inpatient or outpatient. So if it's inpatient, if you need a surgery while you're in the hospital, then that's going to be covered under Part A. And if you remember, Part A, you don't have to pay the 20%, but you do have to pay that Part A deductible, which is $1,676. Once you pay that deductible, Part A is going to cover the rest of that surgery and anything else that you need while you're hospitalized. And again, if you have to go back to the hospital within 60 days, you don't have to pay that deductible again. But if it's longer than 60 days, then you have the $1,676 to pay again. If you're not hospitalized and you need a surgery, then it's considered an outpatient procedure. and that falls under Part B. So that's where both your Part B deductible, which is $257 for the year, and the 20% coinsurance come in. If you've already met that 257 on some other medical service, then you don't have to pay that again. You would just pay 20% of the cost of the surgery. So if you are on original Medicare and you have a surgery being scheduled, it's really important to get what the total cost will be and what your 20% ends up being. Remember, there is no maximum out of pocket on that. So if it's a really expensive surgery, then you are not limited in that 20%. Okay, the second column, Medicare Supplement. If you have a surgery and you have a Medicare Supplement, there are different types of supplements that I won't get into today, but let's just say you have one of the more common supplements, which is the Plan G. That's currently, that offers the most benefit that you can get in a supplement plan. If you had a Plan G supplement, then the only thing that you would have to pay out of pocket is your annual deductible, that $257. If you've already paid that earlier in the year, then you wouldn't pay anything for the surgery as long as it was Medicare approved, as long as it wasn't a cosmetic procedure. Again, with the Medicare supplement, you're paying higher premiums, but your out-of-pocket costs are lower. And then if you're on a Medicare Advantage plan, and this is just assuming that you don't have Medicaid coverage also. But if you're on a Medicare Advantage plan and you have to have a surgery that is outpatient, then there's going to be a set copay on your plan that covers outpatient procedures. This copay is going to vary depending on the plans. So that's something that is important if you choose to look at Medicare Advantage plans. You want to look at their outpatient procedure copays. Some might be $200, some might be $400, but typically that's what I see most of my clients paying for surgeries. There may be a deductible that the plan charges. Again, that just depends on each individual plan. If it's an inpatient procedure, then your Medicare Advantage plan will have a set copay for hospitalization, and it will fall under that copay. Typically, my clients typically pay somewhere between $300 or $400 a day for hospitalization if they don't have a deductible on their plan. Okay, and then we'll go to the next example, which is infusions. I have a really small screen, and this camera it keeps blocking me. All right, so for infusions, if you're on original Medicare, if you're just paying with the red, white, and blue card, then Part B generally is what covers medically necessary infusions, which means that you have that deductible if you haven't already met it, plus the 20% of the cost of the infusions. There's no limit. Infusions typically are very expensive. I would urge anybody that needs frequent infusions to consider not using just original Medicare. At least look at the other two options, Medicare Supplement or Medicare Advantage plans, because paying 20% for infusions can get very expensive. I mean, I'm talking more than $100,000 easily. On a Medicare Supplement, that Medigap policy is going to cover that 20%. So after you pay that annual $257, depending on the supplement you have, you may not owe anything else at all. You may not owe anything for the infusions. And then for a Medicare Advantage plan, again, it depends on the plan. I would say most plans mostly pay about 20% for infusions. So it's the same as original Medicare, However, there is an out-of-pocket max built in to protect them. And again, that out-of-pocket max varies by plan. One thing I will say is if the infusion if it does not have to be administered by a doctor, if it's something that you can pick up at a pharmacy and administer yourself, then it may be covered under Part D instead. And so that would be your drug plan. If that's the case, then there will be a set copay for it. And new this year under Part D, there is a limit in out-of-pocket drug cost. You're not supposed to have to pay more than $2,000 per year as long as the drug is covered by your plan. Okay, and then the last example is mobility aids. Under original Medicare, this would fall under Part B medical coverage. And again, similar to infusions, it's a straight 20%. Whether it's 20% of a rental fee or if you purchase it, 20% of the total cost. On a Medicare supplement, on the green, it's going to, depending on the supplement plan, it's probably going to cover that 20% for you after you meet that annual deductible of $257. And then the Medicare Advantage is mostly, on most of the plans I see, it's usually 20%. But again, the maximum out of pocket comes in to protect you. On Medicare Advantage plans, you do have to worry about the durable medical equipment provider and making sure that they are in network with your Advantage plan. Okay, so those are the 3 examples that I thought might be useful information for you all. I believe that's all I have in the PowerPoint. So now I am available to take your questions. Again, I can't give specific information, but I can always be a resource for you and connect you with a licensed agent in your area if you need more information.
Okay. Julie, thank you very much for a very comprehensive and very well-organized presentation. It's very much appreciated.
Thank you.
I want to open the floor to questions concerning any of the information provided. Please put your questions in the question and answer or the chat. Right now we don't really have any in the question and answer area. We do have some things in the chat, but I think most of it has been minor in having to do with a variety of other things. For example, someone had asked about open enrollment in January through March of the year. And do you want to address that?
Sure. I can explain that. So there is when you talk about open enrollment, most people know that as October 15th through December 7th. That's when most people with Medicare Advantage plans can change their plan for the next year. There is also an enrollment period from January 1st through March 31st, where if you're on a Medicare Advantage plan, you can change to a different Medicare Advantage plan. Now, insurance agents are not supposed to promote that or sell it. That's why you don't see a lot of commercials about it. But they give you that enrollment period in case something happens during the first 3 months. Maybe you didn't realize that your favorite doctor wasn't in network with that Medicare Advantage plan. They give you an option to change plans at the beginning of the year. Other than that period and special enrollment periods for, local disasters or, other special enrollment periods, you're pretty much locked into a Medicare Advantage plan throughout the year. So it's good to pay close attention to what enrollment periods may be available.
Okay, thank you. So, folks, any more questions or comments? Please, give us some feedback. So, Okay.
If any of our attendees or people watching this in the future have questions for you, is this the best way then on the screen for them to reach out and contact you regarding questions?
Yes, and that's a mobile number, so feel free to call me or text me at that number. Again, if I'm only licensed in health insurance for 14 states, so I'm happy to be a resource for you. But if I'm not licensed in your state, then at that point, I would need to refer you to somebody who is licensed in your state. For Social Security disability questions, I can do that nationwide and be a resource no matter where you are.
Okay. I think what we'll do now is I think we'll go ahead and sort of close it since we're not getting any more questions. And I want to thank you for an excellent presentation and the time you put into preparing it. And the presentation was very straightforward and very clear. So thank you very
Thank
much.
you.
Appreciate it. Thank you.
Thank you for having me.
Oh, you're welcome. And thank you. Anybody on the board want to comment about anything that's on? Okay, if not, then thank you again, and we'll close the webinar. Okay, bye-bye.